This is Bob with Thrive Wellness, and thank you for joining me for this Wellness Portal presentation on type 2 diabetes prevention, recognizing risk factors and making healthy lifestyle change. A quick look at what we'll discuss today. We'll look at some definitions for prediabetes and type 2 diabetes, along with some statistics on type 2 diabetes and prediabetes. We'll dive into some risk factors, both modifiable and non-modifiable risk factors. Look at some signs and symptoms of type 2 diabetes, so you might recognize some of those early warning signs. We'll look at the glucose insulin response in the body and how the body strives to maintain a healthy blood sugar level and what can happen as prediabetes sets in. We'll look at some complications with uncontrolled diabetes over time, and we'll look at some lifestyle modification for prevention of type 2 diabetes. And finally, we'll put it all together and hopefully reduce our risk for type 2 diabetes. Let's define prediabetes and type 2 diabetes. Prediabetes and type 2 diabetes occur when the pancreas doesn't create enough insulin, that's the hormone responsible for lowering blood sugar, or the body doesn't use insulin efficiently enough to bring down blood sugar levels, resulting in higher than normal blood glucose. With prediabetes, blood glucose levels are higher than normal, but not yet high enough to be diagnosed with type 2 diabetes. Type 2 diabetes is diagnosed when blood sugar levels are higher than the pre-diabetic state, reaching the threshold for clinically diagnosed type 2 diabetes. So there's really kind of a continuum that exists between normal blood sugar levels, pre-diabetic blood sugar levels, and diabetic blood sugar levels. Looking at the graphic on the right side of the screen, the middle column shows fasting blood sugar tests. This is one test that is used to determine blood sugar levels. So normal fasting blood sugars between 70 and 99. Pre-diabetic fasting blood sugar levels are between 100 and 125. And the threshold for diagnosable type 2 diabetes, fasting blood sugar levels are 126 or higher. If a physician suspects you may have type 2 diabetes based on several fasting blood sugar tests, they may order another test called the A1C test. So this looks at a 90-day average for your blood sugar. So what's considered normal is a value below 5.7. Pre-diabetic range is 5.7 to 6.4, and then the diagnosable diabetes threshold is 6.5 or greater. So let's look at the relationship between blood glucose and insulin. So insulin, again, being that hormone that helps shuttle or pull blood sugar out of the bloodstream and into muscles and tissues. So first off, food is consumed, goes into the stomach, and eventually makes its way into the small intestine. Eventually, blood sugar, glucose, is released into the bloodstream. The pancreas is a gland that produces insulin and releases insulin into the bloodstream. So insulin then helps the cells and tissues recognize blood sugar and help to pull it or transport it into the cells and tissues to be made available for energy. So this relationship between blood glucose and insulin plays out regularly in the body anytime that blood sugar needs to be lowered. And ideally, this efficient response keeps fasting glucose numbers between 70 and 99, when we mentioned that fasting glucose test. And then after a meal, the body's goal is to bring blood sugar down to below 140 within an hour, again, to maintain healthy blood sugar levels. Though our presentation today is on prevention of type 2 diabetes, I at least wanted to mention type 1 diabetes and kind of make that point of differentiation between the two. So type 1 diabetes is an autoimmune disease in which the body's own immune system actually attacks, unfortunately, the pancreas, damaging that gland, and it no longer produces insulin. So individuals with type 1 diabetes are reliant on external sources of insulin to manage their blood sugar. So it is important, though, to mention that the same lifestyle changes we'll discuss in the arena of reducing risk for type 2 diabetes also can help an individual with type 1 diabetes to manage their condition. So we just looked at the normal relationship between blood sugar and insulin in a healthy individual that does not have type 2 diabetes or prediabetes. So let's turn now and discuss insulin resistance. So this is the condition that occurs when cells in your muscles, fat, and liver don't respond well to insulin and can't easily take up glucose from your blood. So this results in having higher than normal blood sugar values, which over time can lead to pre-diabetic states or type 2 diabetic states. Insulin resistance is thought to be due in part to a buildup of saturated fatty acids that contribute to decreased responsiveness of the cell membranes to insulin. This is one of the reasons why diet, exercise, lifestyle plays such a crucial role in the development of prediabetes and type 2 diabetes. Let's look at some statistics for type 2 diabetes and prediabetes. So 11.3% of adults in the US, 37.3 million people have type 2 diabetes. 38% of adults, 97.6 million people have prediabetes. When you look at the combination of those two, you're talking about almost 50% of adults in the US having either prediabetes or type 2 diabetes. So it is a very, very prevalent condition. Since there aren't many signs and symptoms of prediabetes, 9 out of 10 individuals with that condition don't know they have it. So unfortunately, this leads to about 15 to 30% of those individuals developing type 2 diabetes within about 5 years without any type of intervention. And this is why it's so vitally important to recognize the risk factors that you may carry for prediabetes and type 2 diabetes, to have that relationship with your primary care physician, seek their advice, potentially get tested, again, if there's enough concern that you are at significant risk for type 2 diabetes. Let's look now at risk factors for type 2 diabetes and prediabetes. First off, non-modifiable risk factors. So these are risk factors that unfortunately we don't have any control over. Family history, is there history of parents, grandparents that have had type 2 diabetes that could suggest that there may be a genetic component at play for you. Race, African Americans, Hispanics, Native Americans, and Asian Americans statistically have higher rates of type 2 diabetes. Age, as we get older, generally the statistics suggest that our risks are greater for type 2 diabetes. If you've had gestational diabetes or polycystic ovarian syndrome, those are some other non-modifiable risk factors as well. Looking now at modifiable risk factors. So these are risk factors that we do have a good deal of control over. Weight is by far the most important of these modifiable risk factors. Statistically, 90%, upwards of 90% of individuals who have type 2 diabetes are also overweight or obese. So there's a significant component or relationship between weight management and those underlying conditions such as insulin resistance, prediabetes, and eventually type 2 diabetes that take place. Having a poor diet, if we're consuming too many fatty animal foods, too many fried foods, too many refined carbohydrates in general, and taking in too much energy, too many calories from those foods, that is a significant risk factor. Being inactive or sedentary, again, if we're active, we're burning off a lot of calories. We're helping to keep our weight in check. Other modifiable risk factors include things like high blood pressure, having abnormal cholesterol, and triglyceride levels. So if you are seeing any of these risk factors lining up for yourself, I would, again, strongly encourage you not to ignore them. Speak with your doctor about your risks, potentially get tested. Again, a simple finger stick test or a blood draw can show you what your fasting blood sugar levels are. Again, take advantage of your wellness program, health screening, which will give you those values on site. Take the prediabetes risk test through the Center for Disease Control. Again, some simple questions can help you identify your overall risk. Let's look at some signs and symptoms of type 2 diabetes. I mentioned earlier that prediabetes really doesn't come with any signs and symptoms, but as the condition develops into type 2 diabetes, there are frequent and regular signs and symptoms. Excessive thirst is one of those, which is a byproduct of the body trying to dilute the blood and the concentration of blood sugar in the blood. And along with that, you'll experience frequent urination. Losing weight without trying, again, quite a bit of the blood sugar is not being absorbed and used for energy. That can leave you with a deficit, which can lead to weight loss. Feeling tired or weak, again, as a result of not all of that blood sugar being converted into usable energy. You may experience blurry vision. Blood sugar in excess can damage parts of the eye. You may experience frequent infections or slow healing of wounds. With high blood sugar, that can spurn infections because those bacteria actually feed on sugar. You may experience tingling or numbness in the hands or feet. Again, for the same reason, high blood sugar can damage nerve cells. You may experience dark patches of skin around the neck, armpits, groin, or other areas. This is due to high levels of insulin. And you may feel irritable or experience mood changes. There are many complications common with type 2 diabetes. Individuals that have type 2 diabetes are significantly more at risk for other chronic conditions as well. Heart disease being one of those. Diabetics are up to 4 times more likely to eventually have cardiovascular disease. And this is due to high blood sugar levels and high insulin levels being very inflammatory along the arterial wall and within the body. Alzheimer's disease and dementia, another common occurrence with diabetes as you age, again for that same inflammatory reason in the body and in the brain. Nerve damage leading to diabetic neuropathy, which again causes pain in the feet and in the hands. Kidney damage over time, which can lead to kidney disease. Eye damage and vision loss, foot damage, skin and mouth infections. So unfortunately, there are many, many complications that go hand in hand with type 2 diabetes. So it's not just that condition that you're battling. It's also all those other interrelated conditions that can crop up with type 2 diabetes. So that's part 1 of our discussion on prevention of diabetes. In part 2, we'll dive into all the specifics on lifestyle modification for diabetes prevention.